Hey guys, this is your family's chiropractor, Dr. Rose, and today I'm going to be bringing you a life free of ear infections. This is our monthly workshop that we do right here at Rose Chiropractic and Wellness, so if you're ever interested in hearing the live version, just give us a call and we'll give you those dates. Now, what are we going to be talking about today? Well, obviously ear infections, but we need to know what they actually are, why our kids get them, and how do our kids get them. Now, before we jump into all of that, I just wanted to explain to you a little bit about me. My name is Dr. Rose. That is my wife, Erin, there. I am the owner and doctor of Rose Chiropractic and Wellness. I got my chiropractic degree and also my bachelor's in health and wellness at Parker College. And I'm an Epic Pediatric trained and certified doctor. And what Epic Pediatrics is it is a group of doctors that is determined to change the world when it comes to pediatric care. So that's a little bit about me. Let's jump into these ear infections here. So what is an ear infection? An ear infection is called otitis media by the medical community. It's an infection that occurs behind the eardrum in the middle ear. Middle ear infections is the most common childhood illness treated by pediatricians. 75% of all kids have at least one ear infection by the age of 3. So ear infections are very, very common. The most treated common childhood illness by pediatricians. And the majority of our kids get these. So kind of a big deal that we actually know what an ear infection is. Now, fluid builds up behind the ear, that middle ear. So what you're looking at is right through there. That's where all of the fluid builds up, and that's where it gets trapped because this eustachian tube gets closed, fluid builds up, gets infected, there's your ear infection. Now, these usually start out with the symptoms of a cold. So at first your child may have the sniffles with clear nasally fluid. Then congestion comes next with a yellow mucus that lets you know that mucus is starting to get clouded, starting to get infected. Then the low-grade fever comes in, which is your body trying to kill off the infection. So most ear infections really do start out as a cold. So you start seeing these in your child, these symptoms, probably a good indication that an ear infection is coming. Okay, so there's 3 forms of otitis media. There's acute, which come on quickly, sudden, but temporary inflammation of the middle ear. There's recurrent ear infections. These recur, obviously, repeatedly. The ear return to normal in between episodes. And then there's chronic effusion, which you don't want. It's chronic persistent fluid trapped in the middle ear, but it's not painful. But there still is fluid there that doesn't need to be there. So those are our 3 forms of ear infections. Now, this affects over 7 million kids a year. It's the most common diagnosis by pediatricians. Ear infections are in the top 10 reasons of why to visit an ER in the United States. Just 1.6 million in 2006. Children under the age of 15 accounted for 24.5 million additional visits to the physician. Almost half of all children before the age of 1 will experience an ear infection, 1/4 of these being recurrent. So this is a big, big deal. Happens all over the United States. It's in the top 10 reasons of why we go to the ER, so we need to know about it. So what's this cost? In the U.S. alone, this illness is responsible for 25 million office visits annually, with direct cost of treatment totaling $3.5 billion annually. Health economists add that if you include lost wages for parents, the total cost tops $6 billion annually. That's a yearly rate. That's a big deal. $6 billion in total costs due to lost work, $3.5 billion annually in bills. That's a crazy amount. So what we're going to talk about a little bit later is how do we get this pressure off us? How do we make sure that our kids do not get ear infections? But before that, a little bit more about this. Many of these treatments heavy in antibiotic use and surgical procedures are often unnecessary in most children. Experts continue to argue about the best approach to treating ear infections. The major debate rests on the use of antibiotics, surgery, and watchful waiting when treating both acute and chronic ear infections. So the medical community right now is kind of up in arms on how to treat ear infections. You have those that want to watch and wait. You have those that want a drug right away. And it's becoming a big issue. So most children with ear infections, about 80%, actually recover on their own. Docs are starting to say no to antibiotics when it comes to ear infections. And this is in an attempt to fight antibiotic-resistant drugs. About half of all antibiotics used to treat preschoolers are for ear infections. Health officials believe if they can reduce childhood antibiotic use for such infections, they can stop the rise of antibiotic-resistant germs created by overuse of the drugs. So this is your super germs that we're actually creating because of all the antibiotics that we're using. And not to mention that every time you take an antibiotic, it really does wipe out your immune system. It clears out all the good bacteria you need to fight your flus, your colds, and even your ear infections that'll happen again. So antibiotics are very powerful. It's not something that should be taken lightly. Now what's happening is like I said, we're starting to overuse antibiotics. Most of the antibiotics prescribed in the U.S. are for the treatment of ear infections, in light of overwhelming evidence that antibiotics are not necessary in most cases. So we're throwing drugs at it too quick, we're overusing them, when a lot of time we should just let the ear infection run its course and not drug right away. So antibiotics do not appear helpful in preventing fluid buildup in children with ear infections. When prescribed to kids with middle ear infections, antibiotics are not associated with significant reduction in fluid buildup in the ear. Now remember, an antibiotic, what it's going to do is it's just going to make sure the fluid doesn't get infected. The fluid's still there, so your chances of getting another infection after your dose of antibiotics is over with is very likely, because we're not helping the ears drain whatsoever. So this is from the May issue of Pediatrics in 2004. There's new guidelines for treatment of otitis media. Remember, that's your ear infections. Watchful waiting for at least 3 months before recommended treatment. So remember, what most docs do is they're throwing drugs right away, when the best thing to do is to watch and wait. Antihistamines and decongestants are not effective for ear infections. Antibiotics and steroids not recommended for routine management. Adenoid removal should not be used unless there is a specific reason to do so. This is more likely now more than ever, because they're starting to see research that shows that adenoids are very important to fighting a certain type of throat cancer. So watchful waiting, what is this all about? Another 2005 study surveyed parents and doctors on their perceptions of watchful waiting. Results showed that even though watchful waiting was recommended, few doctors actually practiced it. Parents who had a higher educational level, more knowledge of antibiotics, and greater involvement in their child's health care were more satisfied when given this option. So remember, antibiotics are very, very powerful. Every time we give a kid an antibiotic, we're also depleting their immune system. And if they continually are on antibiotics, guess what? They're not going to have a very good immune system. They're likely to get more infections and deal with other things like allergies, eczema, and those type of issues, because their immune system is so depleted. So watchful waiting is definitely recommended. So here's a fact. All drugs have side effects. I don't care what type of drug it is. All drugs have side effects no matter what. So here's Wyatt's story. In May of 2008, Wyatt Reese Lehman, aka Pie Man, that's what his family called him, was a healthy, happy baby with a loving family and an adoring older brother. That all changed when a simple ear infection prompted doctors to prescribe Wyatt a common antibiotic, amoxicillin. This is used in the majority of ear infections now to help cure the bacteria in that fluid. So a short time after Wyatt was given amoxicillin, he became agitated, had diarrhea, and began to break out a head-to-toe rash. And you could definitely see the rashes there across his face and on his cheekbones. So Wyatt was admitted to the ER, where it was found that he was near complete liver failure. He was listed as status 1A, the highest level to receive a liver transplant, and transferred to the UCLA for operation. Unfortunately, time would run out for this beautiful little boy. He died in the arms of his loving mom just 30 days after taking antibiotics for a simple ear infection. So this is not meant to scare you, but to really show you the importance of knowing that antibiotics are very, very powerful. They are drugs that can cause a side effect of that drug can actually be death. So these are not to be taken lightly. Watchful waiting, definitely recommended before we do any sort of drug to treat these. So if not antibiotics, then what? What can we do to help resolve these ear infections? Well, the next step is usually surgery. tympanostomy, I'm sorry there, tube insertion is the first choice for surgical intervention. Approximately 20 to 50% of kids who undergo this procedure may have OME, relapse, and require additional surgery. Because what happens, the hole closes and the tube pops the tubes right out. So you have to get tubes again if you have recurrent ear infections. So this is really just temporary. It's kind of scary that you have to put your kids underneath anesthesia to do this procedure, and the likelihoods of it actually being a one-time procedure are not very high, because 20 to 50% of kids relapse and have to do this again. So surgery is definitely not recommended, and it's something that you have to do multiple times to really get a good result. So here's just a picture of what the surgery actually is. There's your incision into the tympanic membrane, and there is your tubes being placed in that. So this is actually, believe it or not, the most common childhood surgery. According to the New York University School of Medicine, laryngotomy and tube replacement is the most common surgical procedure performed in kids as of 2003. Now we're in 2015. I bet you this has gotten worse, largely because otitis media is the most common reason for children to be taken to a doctor's office. Remember that? Each year, more than 500,000 ear tube surgeries are performed on kids, making it the most common childhood surgery performed with anesthesia. As many as 30% of children undergoing laryngotomy with insertion of ear tubes need to undergo another procedure within 5 years, with an average cost of $2,174 per procedure. So this isn't cheap, and you have about a 30% chance that you're going to have to do it again. So surgery is really not the way to go with this thing, and there's got to be other ways to treat that, which we'll jump into in a couple more slides. So if tubes don't work, use of ear infections for not consistent with expert guidelines, study says. So even though they're coming out with studies, this is published in 2008, that the use of tubes are not really consistent and not really helpful in treating and getting rid of ear infections. So really what we're doing is we're just treating the symptoms, not the cause. So just as mosquitoes will always return to the swamp, bacteria will always return to the eustachian tubes as long as there is stagnant fluid. So this is the cause, the stagnant fluid. This is why they're inserting tubes to try and drain this fluid, and then when tubes pop back out, the fluid builds right back up. So a swamp is, think about a swamp. A swamp is going to be nasty. There's going to be things that growing in there. It's stagnant water. It's going to get infected. So the cause of the ear infection is the stagnant water. It's the swamp that happens in the middle ear. So why does this fluid get trapped there? What's going on? Well, you have these muscles in your inner ear. Okay, one of them is called your TVP muscle, or your tensor veli palatini muscle. It's found on the interior lateral to the levator veli palatini muscle. It arises by a flat lamella from the scaphoid fossa at the base of the medial pterygoid plate, from the spina angularis of the sphenoid, and from the lateral wall of the cartilage of the auditory tube. Now the tensor veli palatini muscle is innervated by the medial pterygoid nerve, a branch of the mandibular nerve, the third branch off the trigeminal nerve. This is cranial nerve 5. So what does all this mean on the insertion points and all this? What does it actually do? Action is used with mastication to help you chew, and the opening of the eustachian tube through its functioning of tensing the palate. So we have the fluid that gets built up. It's because the eustachian tube gets blocked. It's really because this muscle is not working properly, because one of its direct actions is the opening of the eustachian tube. So let's trace this back. If the muscle is not working, it's usually because the nerves going to the muscles aren't firing correctly. So nerve fibers can be traced from the TVP muscle to the cervical plexus, which is located between the spinal levels of C1 and C4. These are the bones in your neck, and these are the top 4 bones in your neck. That's where these nerves come from. Now, subluxations affecting these levels are responsible for the deranged function of the tensor veli palatini muscle, resulting in pathological response otitis media. So, if these muscles aren't receiving the correct nerve supply due to subluxation, they're going to start to malfunction and not open that tube. That's going to result in your ear infection. So where are we talking about C1 through C4, so right through there. And they have a direct correlation with ear infections because they house the nerve supply going to your TVP muscles that opens up the tube. Okay, so some logic and proof here. 200 pediatricians and 200 chiropractors were selected and surveyed to determine what, if any, differences were to be found in health status of the response of the respective children as raised under different healthcare models. The chiropractic kids showed a 69% free otitis media response, while the medical kids had 20% otitis media free response. So, chiropractic kids, what's going on? Why are they having less ear infections than the medical kids? Well, we'll jump into that in just a second. So 93% of all otitis media cases improved under chiropractic care, 93% in 10 days or less, and 43% in 2 visits. So this chiropractic thing and what chiropractors can do is really help your child, first off, improve from ear infections and make sure that they do not come back. So how can chiropractic do this? I mean, I've never heard of chiropractic treating ear infections, some of you might be thinking. Well, believe it or not, 80% of our kids have blocked nerve impulses in the upper neck area can lower resistance and leave the child vulnerable to ear, nose, and throat infections. Structural changes cause muscle spasms and blockage of the ear tubes draining the middle ear. A chiropractic evaluation is of decisive importance. Chiropractic care can often bring about amazing successful results. So chiropractic works with ear infections because we're returning nerve supply to that TVP muscle so it can open up that eustachian tube. And we see this all the time in my office. So you live your life through your nervous system. Remember, nerves are controlling that TVP muscle. This is a picture of your autonomic nervous system. It shows you how nerves exit your spine and they go to every single muscle, organ, tissue in our body. So it's very important that your nervous system is working. If your nervous system's not working good, guess what? Nothing else is going to be, and especially that TVP muscle that controls our eustachian tube. So what is that subluxation word? Subluxation is nerve interference. And basically it comes from stress. It can come from physical, emotional, or chemical stress and creates problems in our system. When we have nerve interference, we have dis-ease, which means our function's down. When we can't function right, we get symptoms. The best way to describe it is a subluxation. It's almost like having a garden and you having hose going to every single plant there. Well, if you have partial misalignment or blockage in the water flow there, the plant's not going to receive the water it needs and it's going to start to actually malfunction, or it's not going to be as healthy. Then if you have complete blockage in that flow, the plant dies. So subluxation is like blockage in your nervous system. So this is just real quick a cool study of people who had regular care, chiropractic care. This was done by Ronald Perot. He's the chief of cancer prevention research at New York Preventive Medicine Institute. So this guy's not messing around. What he did is he took 3 groups of study. People who have been under regular chiropractic care for 2+ years, people not under care but deemed healthy, and people who were sick, had chronic conditions, and had cancer. So what he found was that chiropractic patients had a 200% greater immune competence than people who had not received chiropractic, and 400% greater immune competence than people with cancer or other serious diseases. So they had a 200% greater immune system. Chiropractic may optimize whatever genetic abilities you have so that you can fully resist disease. How do you have a greater immune system? Well, chiropractors remove that subluxation from your system, which is nerve interference. Then your immune system is able to get the nerve supply it needs and function at its absolute best. Now, real quick, here's some scans that we do in my office. This goes to show you what we can really do to improve your child's health. And what this is, and it's not easy for you to figure out, red is bad, black is bad. And majority of ear infections, remember, are from nerve blockage in that C1 through C4 area. Well, this is one of my patients, Stella. Now, Stella came in, she was having bilateral ear infections, had allergies, and had eczema. Well, this is her very first scan. Like I said, red is bad, Black is even worse. So she had a lot of subluxation going on in her upper neck. Now, through care, this is just a month later, you can see that it's improving. Ear infections are starting to go away. Okay. Now, this is just another month later, where guess what? We're completely clear. Do we have ear infections anymore? No, not at all. None of that allergies going on, none of that eczema going on, because we removed that subluxation, that nerve interference, and then that TVP muscle was able to do its job and keep our tubes open, and then that results in no more ear infections. That's just a little picture of Stella there. She's an awesome, awesome kid. No more ear infections, living life to its fullest potential. So I'll bet you some of you are thinking, what if? What if my child is subluxated? What if I have subluxation? What can I do to get this all figured out? Well, what you can do is definitely come and find out if you do have subluxation. We want to check and make sure it's a chiropractic problem first before we do anything else. This is just some information on my office. We are located at Heritage Trace Parkway in Fort Worth, Texas. Give us a call and we can get you in. Our number is 817-741-8040. And that number again is 817-741-8040 to see if your child has ear infections and to get a scan and to see if it's a chiropractic problem. Thank you guys for listening to my ear infection workshop. If you have any questions on it, don't hesitate to email me or give us a call. Thanks again, and I look forward to seeing you.